Hello, my name is Despina and today we're going to talk about cardiorespiratory endurance VO2 max and Cooper test. Cardiorespiratory endurance refers to the ability of heart and lungs to deliver oxygen to working muscles during continuous physical activity, which is an important indicator, of course, of physical health. Cardiorespiratory endurance is typically measured in laboratory by maximum oxygen uptake, VO2 max. The heart rate is the most direct response to physiological indicators during quiet rest, exercise, and after exercise. Maximum heart rate refers to the fastest rate at which your heart will beat in 1 minute and is commonly used in exercise physiology and clinical practice for preventive and diagnostic purposes. It is also used to develop exercise prescriptions, estimate aerobic fitness levels, and is often a criteria for achieving maximal exertion in the determination of maximal aerobic capacity. Resting heart rate is the number of beats per minute of the human heart after a long rest, usually measured in the morning when you wake up and have not yet gotten out of bed. It's normally between 60 to 70 beats per minute. Heart rate recovery is the speed at which the heart rate returns to normal after exercise, and it can indicate physical cardiac conditions and the risk of certain diseases. People in better cardiovascular condition tend to have lower heart rates during peak exercise and return to their resting heart rate more quickly after physical activity. Heart rate recovery is the speed at which the heart rate returns to normal after exercise, and it can indicate physical cardiac condition and the risk of certain diseases. People in better cardiovascular conditions now tend to have lower heart rates during peak exercise and return to their resting heart rate more quickly after physical activity. A person's VO2 max refers to the maximal amount of oxygen the individual can consume, typically over 1 minute during an intense physical effort. The oxygen uptake of the human body is directly relative to the exercise intensity. Therefore, the oxygen uptake of the human body is an indicator of level of physical activity. Typically, VO2 max is measured directly by analyzing inspired and expired breathing gases in a laboratory setting during maximal exertion and expressed also as an absolute maximal amount of oxygen per minute, liters per minute, or as an relative to the individual's weight as the maximal milliliters of oxygen to the person uses in 1 minute per kilograms of body weight. Now, even if you're not an athlete, improving your VO2 max can potentially improve your overall health. Low levels of cardiovascular fitness correlate with an increase of risk of heart diseases. Increasing your overall levels of cardiovascular fitness is associated with benefits such as better quality of life, reduces stroke risk, reduce risk of heart diseases, diabetes and cancer, and of course, improved mood and better sleep. So let's talk about Cooper test. The 12-minute run fitness test was developed by Cooper in 1968 as an easy way to measure aerobic fitness and provide an estimate of VO2 max for military personnel. But today, it's used by many different trainers to determine cardiovascular fitness and track fitness over time. This test requires the athlete to run as far as possible in 12 minutes and the distance is measured. Penry 2008 shows that Cooper test is reliable. Also, he said that direct measurement of VO2 max is expensive, both in terms of time and cost of accurate gas analysis. Thus, various predictive tests have been devised to evaluate aerobic fitness. Also, Cooper test is an easy and not expensive way at all to examine the cardiovascular endurance and predict the VO2 max of a participant. The test administrator now counted the laps completed during the 12-minute test period, while calling out the time elapsed at 3, 6, and 9 minutes and verbally encouraged the participants. At the end of the 12-minute period now, the test administrator called the participants to stop and the measuring while was used to determine the fraction of the last lap completed by each participant. The distance was added to the distance determined by the number of laps completed to give the total distance covered during the test and then estimate VO2 max. The formula for calculation based on miles run is VO2 max equals 35.97 multiplies miles minus 11.29. The formula for calculating kilometers is VO2 max equals 22.351 multiplies kilometers minus 11.288. Today we're going to use the formula of calculating kilometers for this test. Cooper's 12-minute run test is based on the principle that the distance run within 12 minutes is very closely correlated to the oxygen defunction in the body. The ability to use oxygen efficiently is a good sign of fitness, of course, and including cardiovascular fitness levels. However, there are some variations that may change the results of the test. For instance, highly motivated individuals may push themselves to run farther than usual. So how to improve VO2 max at the aerobic endurance? You can increase your VO2 max in two ways: by increasing the amount of blood your heart can pump, by increasing how much oxygen your muscles can take up. Also, an important recommendation from the authors is exercise at high intensity. Found that interval training also produces slightly better VO2 max improvements than continuous aerobic exercise. Interval training consists of alternating short periods of high intensity activity with periods of rest.
So here is the area that our participant is gonna run. Go. Three minutes. Go, 6 minutes. 9 minutes. Stop. Stop. Bravo. Bravo, good job.
Before the test, I went to the field area and one lap equals to 120 meters. Our participant did 19 laps and 60 meters, so the final distance was 2,340 meters. This table here is the result of the 12-minute Cooper test run, and as we can see from here, our participant is 23 years old, so he did 2,340 meters, so his rank here to an average. Maksud and Kutz 1971 gave this table for estimate VO2 max. So here are for yards. In we had 2,340, so in yards is 2,550, so approximately here. And if we go here, we can see that it's approximately 42. So let's see the estimation with the calculating formula. So as we said before, the formula for calculating for VO2 max is VO2 max equals 22.351 multiplies kilometers minus 11.288. When you're doing the formula, the result is 41. So let's go back to the chart to see where it's categorized. Okay, let's go back to this chart. Man's VO2 max chart by age. Let's go to here, 24, just because our athlete is 23. So as we can see from here, our athlete is categorized here, fair. So next time we have to train him to get better results.